October is here and stakeholders are coming together to observe Cancer Awareness Month throughout Guyana. Initially, October is recognized for breast cancer awareness in women all across the globe. However, with the rising prevalence in other cancers, it has been deemed equally important to join forces and bring awareness on the prevention and control of all cancers. Before we get into the actual details about cancers and stakeholders' participation in the month of activities, we take time to hear some survival stories.
Deborah Lowe, Anna D. Morris, and Golda Clemenson are just three of the many survivors who are willing to share their stories to encourage persons battling with breast cancer and other cancers. We start with Deborah. Following her husband's death, life became a daily struggle, even during her recovery phase. After receiving her diagnosis, Deborah was unsure of her chances of survival, despite doctors' assurances.
I'm a breast cancer survivor. I consider my experience as being a bittersweet one because I've seen both sides of the coin. Myself and husband was diagnosed in 2015 with cancer. I was diagnosed in January, he was diagnosed in March. Unfortunately, he passed away in November. I never really get the opportunity to know somebody that had cancer. And what I know about cancer is when you have cancer, you die, right? But then at first, when I was diagnosed, that is how I was thinking. But then when I went to the clinic and the doctor explained to me what is it and I could survive, what I have to do, you know, we start to accept it.
Having accepted the verdict, Deborah said she boldly walked her road to recovery with tremendous support from close family members. This support was credited with making the treatment and recovery less distressing.
Well, everybody was surprised because the first thing they say, a small person like you, how come you get breast cancer? But they were very supportive. All my family and my husband's family, they're long distance. Everybody is abroad. But for my surgery, all my sisters were there.
Golda Clemenson, a cervical cancer survivor, also shared her story.
I'm happy to be here today to enlighten and to share to persons out there that cancer is something you don't buy, and you can boldly speak out. And the more you speak out and get people to know what you're feeling and what's going through, you can get help. And there's life. Cancer is not death. How I come about knowing I'm a cervical survivor patient was getting some signs of bleeding. And I take it up on my own to go see Dr. Gubin, the gynecology doctor, and there's where I did the biopsy and found out that I was cancer positive, cervical cancer positive. From there on, I went to the Cancer Institute and spoke with Dr. Siam, whereby he then referred me over to the GPHC where I met Dr. Goodin and her team there to get along with the chemotherapy treatment. I did chemo, and my chemo was cisplatin. It was a bit different with every person that I would have met with because most of them did a different type of chemotherapy. Mine was cisplatin, where I did not lose my hair, and that was something positive for me.
With a new and positive outlook, despite the diagnosis, Clemenson went straight into treatment.
With the chemo, I was doing the radiation too. During the treatments, both chemo and radiation, I will tell you, it's according to my sister, it is more than catastrophe. That is agony. Because why I say that, every person's body reacted different to treatment. My story was, I guess, wasn't that much different from persons, but it was a hell of a thing. But me, I'm always a positive person. And at first, when the doctor called me in to tell me that, Golda, you have cancer. I said right away boldly, so doctor, what is the next step? He said, he was looking at his assistant and they were looking at me. I wasn't moved in emotion because like somehow I just didn't, it never get to me really to break me down. I bravely went about doing my treatment. Did not miss none of the days because I know it was very important. One of the key things, I listened to what the doctor advised to do, and that is what I follow on with. I went through a lot of pain, burns, and so on from the radiation, a lot of belly pains and vomiting and sickness and so on, but I stand up tall to it all. I went home like nothing did really, transpire to me and so on, and I told my husband, I went to the doctor and he told me that I'm diagnosed with cervical cancer. I took a while to tell my other sisters them because we would have been lost, we had lost loved ones, it was going rapidly, so I know the thought out there that once you have cancer, you're gonna die. So I withheld the information from telling my close friend, my close family, besides my husband. He didn't know first. But then afterwards, I have a sister who is close to me. I call her and then I tell her when I was already in the treatment.
Now we hear of Anna de Morris's story. She has had her first diagnosis of cancer in 2008. Since then, she has been diagnosed with 2 additional cancers and has been fighting the disease head-on.
Well, I was diagnosed in 2008, the 29th of August, and I did surgery October 2008, the 19th, and by the December, it got to my lungs. I had 13 months of chemotherapy. Doctors give me up to die. After it go to the lungs, I wasn't breathing properly. I couldn't sleep. I had to sit down and sleep. And it was very uncomfortable. Fever was going to my head. Yeah, doctors give up on me. By 2015, it come now to the left side breast. So doctors told me I take it a little hard then when I know that it come back to the left side breast, because from the right breast to the lungs and now to the left side breast, I go through 6 months of chemotherapy and I take off the breast. In 2018 of this year, March, I was diagnosed with cancer again. 4th time. I did 25 sessions but I take it very hard. I take it very hard. I could tell people I take this hard because, I didn't expect it. I bore along in the doctor's office. They said, leave me, let me cry it out. And the next thing the order was radiation. I had 26 sessions of radiation. It was very hard. I couldn't walk. I couldn't sit down. The burns were so severe that at one time, I see that this time here, I said, God, I ain't able no more. I said, God, I ain't able no more. Because, you can't sit on pain. At one time, that to stop the radiation for 10 days and then put me up on it, and then it was worse then.
As survivors, Deborah, Golda, and Anno now encourage other women who have been diagnosed with breast cancer, cervical cancer, vaginal, or any other cancer to be unashamed.
Don't be ashamed. The first thing you have to do is take care of yourself, your body, your health. Because to my understanding, cervical cancer came about with the HPV virus, the human papillomavirus. And it comes about with when you have a partner or your husband who is unfaithful and have various sex partner involved in various sex activity unprotected. And I also heard with other tablets and so on. So to say that you would be shamed when you heard that you have cervical cancer, no, it's just that you have to be careful, be wise, take care of your health. And now that they have the vaccine sharing, I wish I could have gotten it. I'd have gone without thinking.
So I want to tell others that, when they hear about cancer, is not dead. It's not dead. Cancer is something will give you a wake-up call. Your lifestyle, your eating, everything. It changed your whole lifestyle.
Global statistics gathered indicate that 1 in every 4 women loses the fight against breast cancer. While other cancers have a significant impact on women, recently more attention is being placed on the adverse consequences and effects on both women and men.
Over the past years, deaths and disabilities resulting from cancer-related illnesses were not very significant. Unfortunately for Guyana, the data shows that cancers are slowly moving up the table to sit as the 5th leading cause of deaths in the country. This is according to Minister within the Ministry of Public Health, Dr. Karen Cummings, who pointed out that the influx of the fast food industries, lack of physical exercise, tobacco and alcohol use, and irresponsible sexual behavior contribute to the increase.
We live in a country where treatment and screening for cancers are somewhat limited. But this limitation doesn't necessarily explain the rise in the tolls. The government of Guyana, through the Ministry of Public Health, has begun to explore and implement numerous activities that will seek to curb this cancer epidemic. And some of these activities include appropriate staffing of the chronic non-communicable disease unit, allotment of adequate budgetary resources, training of healthcare professionals in the area of oncology, public-private partnerships with non-governmental and non-profit organizations, research and surveys, establishment of an oncology unit at the Georgetown Public Hospital Corporation, and robust screening and preventative methods available free of cost, such as VIA, HPV and hepatitis B vaccines, HPV serological testing, and radiological services.
The minister explained that the ministry is fostering effective collaboration with technical support agency in Guyana, PAHO WHO, to take a hands-on approach towards addressing cancers.
Subsequently, an active mission is currently being undertaken by the Chronic Disease Unit in collaboration with PAHO, WHO, our good friend, to put together a strategic plan for cancer prevention and control. It is envisioned that this plan will become reality in early 2019 and will be the product of wide cross-country consultation with all relevant stakeholders. This plan will obviously give way for the implementation of many more permanent measures, including ensuring treatment availability locally.
Dr. William Adukro, PAHO WHO country representative, stressed that as Cancer Awareness Month of activities is ongoing, there should be much more emphasis on providing treatment alternatives for those persons diagnosed with cancer. He made this and other statements at the launch of Cancer Awareness Month.
Globally, the most common type of cancer in women is breast cancer. In the Americas, more than 408,000 women were diagnosed, and out of that, 92,000 women died in 1 year. That means 1 out of every 4. I think that tells us a lot. And that tells us the fact that the mortality rate once diagnosed is also very high. Guyana recorded 6,518 cancers for the period 2003 to 2012, for an overall cumulative incidence rate of 867 per 7 per 100,000 population, and an annual incidence rate of 87.3 per 100,000 population. Of these, 3,956, about 60% were females, and 2,561, about 40% were males, giving a female-to-male ratio of 60:40.
Dr. Adukro said cancer continues to be the leading cause of death in women. Therefore, more must be done at a country level to protect and guard our women.
In Guyana, breast, cervical, and uterine cancers are the leading causes of death from cancers in women. The rise in cancer incidence and the disproportional high mortality rate continue to impact the well-being of families and place a substantial demand on health systems and services, and hamper the human, social, and economic development. PAHO WHO urges Guyana and partners in Guyana to ensure that women live long, healthy lives free from cancers through the following 4-point actions. And they are: action number 1, advocate for women's cancers to be high on the public health agenda. And I think it is, but we just have to re-echo that on ongoing basis. Action number 2, educate, inform, and empower women to seek early preventive health care. Action number 3, ensure that services are available affordable, and accessible for women's cancer screening, diagnosis, treatment, and palliative care. On this note, I would like to sound a word of caution. I hear a lot of agencies saying we are doing screenings. We are doing a lot of screening. We are screening here, we are screening there, we are screening for this, we are screening for that. Ladies and gentlemen, screening without effective referral and quality management is of no value. Action number 4, to engage in partnerships with all constituencies active in the field of women's health to improve the situation for women's cancers.
Placing emphasis on the prevalence of breast cancer and its effects, Dr. Adu Crow said PAHO WHO is stressing the need for the availability of effective treatment regimens for those diagnosed.
Breast cancer can be detected early and treated effectively. This is the message PAHO WHO is promoting. When breast cancer is detected early, and if adequate diagnosis and treatment are available, there is a good chance that breast cancer can be cured. If detected late, however, curative treatment is often no longer an option. In such cases, palliative care to relieve the pain and suffering of patients are needed. There is a need to strengthen health promotion and health education efforts aimed at improving awareness and understanding among women about the importance of screening and early detection for breast cancer, and not to postpone seeking care in the presence of signs or symptoms.
The PAHO WHO representative made the point that cancer can affect anyone. Therefore, it should be taken as a personal responsibility of every person to know their status. He also said apart from the socio-economic effects, cancer has psychological repercussions for patients and their families and remains in many parts of the world a stigmatized disease.
Non-profit and non-governmental organizations have, over the years, taken up major responsibility in the fight against breast cancer. However, they have now shifted their focus to raising awareness of all cancers in Guyana. The Cancer Institute of Guyana, the Giving Hope Foundation, GTT, to name a few, have been intensely involved in raising awareness on what the month of October means and how the country as a whole should address cancer.
Those from civil society have come out boldly in the fight against all types of cancers and have partnered with the Ministry of Public Health to advocate for the life-saving method of early detection. Curtly Williams, Vice President of the Giving Hope Foundation, explained he has lost 2 of his family members to cancer and is now committed to the cause of saving a life through public awareness.
I stand resolute in the fight of bringing this awareness to the nation, because as one who would have lost a sister to breast cancer and a mother to cancer, but pancreatic cancer, I understand the pain and the suffering that we all feel sometimes. In 1985, a partnership between the American Cancer Society and the Pharmaceutical Division of the Imperial Chemical Industries, a leading manufacturer of oncology drugs, October has been designated as the month to where we raise awareness of breast cancer. This is intended to increase global awareness and educate the world about preventative methods, early detection, and to raise money to support the research to fight this disease.
Though the initial focus of the foundation was to reach out to breast cancer survivors and their families, they have found that the needs are far stretched from what they had planned.
We would have been embarked in a number of areas whereby we bring awareness to the population. And we offer services such as the clinical breast examination, pap smear, visual inspection and acetic acid for cervical cancer, digital rectal examination, prostate-specific antigen. We also involve in eye tests, blood pressure testing, blood sugar testing, and blood donation. And we offer these services free because of the number of donations that we would have received from corporate society and other organizations.
Health promotion and awareness is not solely the responsibility of the government of Guyana through the Public Health Ministry. Fiona Legal of the Cancer Institute explained that they do their bit to successfully target and touch lives of those persons that need the information and the services the most.
The sad truth is that breast cancer knows no boundaries. And because of this, Cancer Institute is very passionate about helping everyone learn about breast cancer, early detection, prevention, treatment, and support. CIG believes with the knowledge comes empowerment, with community comes inspiration, and with support comes with hope. Therefore, partnering with key stakeholders is essential to our success. Multiple community forces, including the government, regional health centers, public and private healthcare providers, NGOs, corporate entities, advocacy, and community groups, as well as cancer survivors, are united to achieve a common goal: advance cancer prevention and control, enhance our medical system, and improve the quality of life of cancer survivors.
While this is done, simple messages are broadcast through various mediums, ensuring the message of cancer prevention meets everyone. The mantra, "Knowledge is power," is being touted.
This month, as we honor those whose lives were tragically cut short by breast cancer, and as we stand with their families, let us arm ourselves with the best knowledge, tools, and resources available to fight this devastating disease. I am happy indeed and greatly encouraged to see the active involvement of so many people and organizations in the activities of Breast Cancer Awareness Month. The battle against cancer cannot solely be the responsibility of the government, nor should it be confined to the healthcare professionals.
GTT has taken the month of October and renamed it Pinktober in an effort to heighten cancer awareness and raise funds for the Guyana Cancer Foundation for screening and treatment of cancer patients. Pinktober, in its second year, is the largest cancer awareness campaign, which also inevitably supports government's mandate of prevention and control. This year, the Pinktober campaign has gone countrywide, with Linden and Lethem towns coming on. For the entire month of October, GTT will partner with cancer foundations to host a number of activities. One such activity to kickstart the month was a tree wrapping exercise, which saw the participation of First Lady Sandra Granger.
So I urge you, get tested early, do your physicals annually, male and female. Get tested. When you go and you're diagnosed at stage 3 or 4, it's too late. So get tested early, please. And follow up and take your treatment, whatever it may be.
All these organizations work in tandem to strengthen health promotion and health education efforts aimed at improving awareness.
As we celebrate Cancer Awareness Month 2018, I want to assure you that the Ministry of Public Health will continue to support initiatives that are geared towards the reduction of cancers in Guyana. We must work extra hard to ensure that citizens are given adequate sensitization to help them avoid the behaviors that contribute to cancers. We must continue to find creative ways to inform Guyanese about the prevention and management of cancer. I urge you, therefore, to continue to work assiduously and do all that is possible to prevent all forms of cancers.
The Ministry of Public Health continues to highlight the importance of screening and early detection for all types of cancer. This has been InfoHub In Depth. Goodbye.